Some hopeful news in Oregon's fight against COVID-19. The state epidemiologist says daily cases and hospitalizations are slowly coming down from recent record highs.
That's right. Fox 12's Audrey Wheel joins us now live with that update, as well as what we could expect to see in the coming weeks and months. Audrey?
Right. Well, Dr. Dean Seidlinger said today that the COVID-19 situation seems to have stabilized after peaking earlier this month, and he expects cases and hospitalizations to decline in the coming weeks. By just how much, we don't know yet, and still going into fall and winter, hospital capacity is a concern. While we're not out of the woods yet, according to the Oregon Health Authority, our latest COVID-19 surge seems to be coming down from its peak.
These are positive trends, but we need to keep up the pressure against the virus. We know from our experience in this pandemic that a slippage in our resolve can quickly erase these hard-won gains.
The latest weekly report shows the number of new COVID-19 hospitalizations fell 42%, the first drop in 9 weeks, with cases and deaths falling too. State epidemiologist Dr. Dean Seidlinger says still the overwhelming majority of people getting very sick and dying are unvaccinated.
Every morning I sit with the new data from the day before. Sometimes I cry. Sometimes I get angry, because much of the disease we're seeing now is preventable, and I wonder, what could I have done to reach even one more person to get vaccinated and take steps to protect themselves?
There are some concerns going into fall and winter. We didn't see a lot of people getting sick with the flu last year, and Dr. Seidlinger says with people going out and interacting more now, it could come back even stronger this year. Plus, hospitals are already strained to a point that's not sustainable longer term. In national headlines, Idaho is having to ration health care because of its COVID situation. Dr. Seidlinger says we're not at that point, but we know there's already been impacts to elective surgeries and routine care here.
If the next surge of COVID or COVID and influenza is higher than this, that is going to strain our systems again. And we could wind up in a situation where we're doing even more rationing of care, similar to what our neighbors in Idaho are doing. We don't want to be there.
Now, on the vaccination front, Dr. Seidlinger says when a vaccine is approved for kids under 12, that will be significant and could give us the momentum we need to really get control of this virus. And he expects booster shots to be available in the coming weeks, first for Pfizer, and likely those people who were initially eligible for the vaccine the first time around will be able to get those boosters first this time around. Reporting live in Northwest Portland, Audrey Wheel, Fox 12 Oregon.